Hi, my name is Lindsay Dye. I'm a nursing student at the University of South Alabama, and today I will be performing the central line dressing change checkoff. I will scan the room. So first I need to verify my order and verify hospital policy. So I have an order for routine central line care per unit protocol. And then I'm going to perform hand hygiene and identify my patient. So we have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. He has an allergy to penicillin and he is wearing his armband for an allergy to penicillin, and there are no other allergies noted. And so now I'll explain the procedure to my patient and provide my patient with privacy. And so now I'm going to raise my patient's bed to a working height. I'm going to lower the side rails, and I'm going to place my patient in a comfortable position with the head of the bed slightly elevated. And so now I need to look and palpate at, around the site of the central line, looking for any drainage, redness, swelling, or inflammation that may mean we need to perform a culture later. And so now I need to gather all of my equipment, and I would place it on a bedside table at waist level and on the same side of my patient that their central line is on. And then I'm going to position my trash can next to my patient's bed, and then I will perform hand hygiene. And so now I need to put on my mask and goggles. And then I will assist my patient to put on their mask. And then I'm just gonna pull my mask down for the remainder of the video. And I'm gonna don a clean pair of gloves. Okay, and now while I stabilize the catheter, I'm going to remove the old dressing towards the center or the insertion site. And then I will remove the bio patch. And then as I do so, I'm going to look for any drainage, redness, swelling, inflammation, see if there's any purulent odors, and that would indicate the need to perform a culture. And then at this time I would obtain a culture of the wound if any of that was indicated. And so now I'm going to, I have the dressing in my gloves. Now I'm going to remove my gloves, glove to glove and skin to skin, and throw those away. And I'm going to perform hand hygiene, and I will open my kit, and I'm going to remove my sterile field and place it on the bedside table closest to the patient. And now I'm going to get my package and dump the contents onto my sterile field, being aware of the 1-inch border. And now I need to don my sterile gloves. Okay, and now I'm going to arrange my contents on the sterile field, being aware of the 1-inch border. And so now I'm going to lift the central line and all the ports with my non-dominant hand. And so now this, my left hand is contaminated, and I'm going to clean around the site in semicircular motions, being sure to go all the way around and going, not going over a spot twice, and going 2 to 4 inches away from the site. and then I will throw that away. And then I need to get my chlorhexidine. I will activate it, and then I'm going to clean vigorously around the site in horizontal, vertical, and circular motions for a minimum of 30 seconds. And I'm also going to be sure to clean the catheter and the hub. And I'm going to be sure not to pass the hub. And then I will throw that away. And now I need to get my BioPatch and place it correctly, so with the blue side up, being sure not to touch the hub. Okay, and then I can lay the lines down. And so now I'm going to get my transparent dressing, and you can see that I'm using the small one, and it's because I ran out of the larger ones, and so I was just I had an extra small one, so I'm just going to use that to simulate placing it on the correct position. And so I will remove the backing, and then I am going to place the dressing over the BioPatch in lines, being sure that the BioPatch is in the center of the dressing. And I'm also going to make sure that all of these sides are down and stuck to the patient. And now I'm going to remove the paper backing and save it for later because of the label. And so I've made sure all the sides are down and my BioPatch is in the center. And so I'm going to save that for the label. So now I'm going to remove my gloves, glove to glove, skin to skin, throw those away. I will remove my mask and also remove my patient's mask and dispose of those. And so now I'm going to come to my label, and I am going to write the date, time, and my initials on the label and remove it from the backing. And then I'll place it on the edge of the dressing, being sure not to cover any sites. Okay, and so now I am going to discard of all of my equipment. And I'm going to lower my patient's bed. I'm going to raise the side rails. I'm going to place my patient in a comfortable position, being sure that their call light is in reach. And I'm going to perform hand hygiene, and I will go to the nurse's station to document, and I will document the site appearance. I will document the amount and characteristics of any drainage if there was any present. I will document if I obtained a wound culture. I will document the type of cleanser used and the type of dressing used, and I will also document the date, time, and then sign it with my signature and note the patient's tolerance to the procedure.